Okay, thank you everyone for joining us today, and welcome to our second session of the CGHI Masterclass Series. For those who may be new to CGHI, we are the Coalition for Global Health Innovation. We are a global youth-led nonprofit dedicated to building a vibrant, multidisciplinary community of emerging leaders. We're from 6 different continents, from over 40 plus countries. We bring together passionate young professionals across diverse fields, public health, policy, research, and beyond. And we share a commitment to advancing equity and inclusion in global health. Our mission is to empower emerging leaders like yourself here today to transform your innovative ideas into actionable projects. And we advocate for health equity and inclusion, and we support young leaders in developing their skills, expertise, and we also have our peer mentorship, and we have our internship program, and we have also a big database of senior professionals together with Multipod. So we have master classes like today's session, and we host regular community calls every 2 weeks to connect emerging leaders from every continent to foster cross-cultural dialogue and partnership. And we also have impactful webinars, which you can find on our YouTube channel. And we also write articles and blogs. You can check out our website. We talk about global health, the pressing global health issues. So I want to invite everyone to check out our website and our page on LinkedIn and connect with us. So my name is Charlie Sutong Zhang. I'm the president and co-founder of CGHI. And today it's my honor to introduce Dr. Molly Fitzgerald, whose extensive background in research, mentorship, and advocacy and program leadership offers invaluable perspectives on building inclusive and equitable health systems and communities worldwide. So I hope you have a pen and paper ready for today's interactive activity. And yeah, please feel free to introduce yourself in the chat, and you can drop your LinkedIn link in the chat box as well. And please share with us where you're joining us from, because we're a truly very diverse community here. So thank you again for being here today. And Molly, the stage is yours. Thank you.
Awesome. Thank you so much. I am going to try to share my screen and let me know if this has worked. I don't think we're seeing the right thing, actually. I'm sorry. Bear with me one moment. Okay, is that working? Are you seeing the
Yes.
first
Yes.
slide? Okay, great. Well, thank you for the introduction. I am Molly, and I am delighted to be here, and thank you so much to CGHI and Multipod for hosting this and for your partnership. I've been in community health. I think I was thinking about it since I was a teenager, by my definition, when I was a youth representative on my local community health services advisory board. And I'm currently in community health as a caregiver, advocate, a researcher, and I wanted to speak with you all today because I know you are also in different ways involved in community health. But what's interesting is that, I learned this from some of you actually on the call, some of the people that I am mentoring, about the fact that community health is something that we talk about a lot. And yet the definition, it's sort of, because we think of it sort of as everything, it also ends up sort of being nothing. So we talk about it in such a loose fashion that the actual definition is a little bit hard to pin down. So I'm going to discuss that a little bit, and the context of community health, and then also kind of think together with you about, as people that are concerned about global health and planetary health, how can we approach it and maybe think of different ways, and then also the context of change and how we might, sort of reimagine this in community. Um, so I just wanted to start by really breaking it down, and even sort of being specific about what we're talking about when we talk about community. And I meant to preface that I actually teach in global and community health. And as I was thinking about this presentation, which is sort of the alternative presentation that I do not teach formally, um, it's interesting that we say global and community health. We don't say the how they're describing it is not, in universities and in books and things, they don't call it global community health. They actually call it global and community health, as though that's different. So I think that's an interesting distinction. But when we're talking about community, what we mean this is just a dictionary definition, but it can be a group of people and living in the same place. Your community where you live, whether it's your city or town or household. It can be also sort of a shared feeling. So affiliations or affinities, shared identities, experiences, perspectives, goals, geographies, struggles, shared trauma, shared survival, persecution, history, aspirations, interests, or the idea of a shared narrative, which is something that I'll get to. But then I also just wanted to, sort of thinking of that definition, think about, and maybe if you could also write on if you could write in the chat, or if one or two people, would like to go ahead and share, what do you see as your communities? Like, what are maybe the first, what are one or two communities that you feel are your communities, like by these definitions? And now I'm not seeing the chat anymore. Oh, here we go. Okay. Anybody?
If I may, I could start.
Go for it. Thanks.
Thank you. So I think my community, I think I have many communities where I belong to. So I am Chinese and I lived in Europe and now in South Africa, also Egypt. So wherever I am, I'm a migrant woman. I'm a migrant Asian woman, and that is the first community that I belong to, because that is very different. Like my access to the local resources, even though like I'm a student or I'm a worker, I have a valid long-term visa, but that's still like I have different access to like public health or subsidies, for example, because of my nationality and my identity as someone who's foreign. And then also maybe now I am also a student as well. And I think, yeah, and also I'm a young person also in the CGHI community as well. So I think we all have many different communities that we belong to. Yeah, thank you.
Awesome. Thank you. Yeah, and then I see church and Latin community. Yeah. So people are saying, different communities, and that each of us it's not just one, right? So I would love it if you have a piece of paper, if you don't want to write it on the chat, feel free to just put on your paper, like maybe if you're able to pick one or a couple of the communities that are sort of most important to you, that you feel compelled to, that are most important to you. And we'll come back to that. Huh. Oh, why is it not? Sorry. There we go. Okay, there we go. My apologies. Um, okay, so then if that's community, then what do we think of as community health? And again, if you just want to put, one or two, what's the first thing that pops into your mind when you think of community health in the chat? Anybody? I'll go on. And we'll come back to this. So think about that as I wanted to also sort of think about that as we step back for a second. And this was new research for me. I myself was started to be curious, about what the origins of community health were. So when I looked it up, and this isn't, some deep research. This is just something I pulled up, on the internet based for this presentation. But I think it's still quite helpful. One of the things that's helpful is if you pull it up sort of on like AI, it doesn't mention the indigenous communities. It only mentions like, you know, as is the limitation sometimes of history or the internet. Even if I were to look up a book, it it doesn't necessarily go back to sort of the indigenous concept of community health, which is really important actually, and very super relevant. Like you can see that this idea of like holistic well-being, integrating spiritual, mental, physical, and emotional health might be something that you would aspire to as a community health person or global health person. And so you can see that it goes way back. I mean, these are just the citations that I have, but there are many early examples, and it didn't really come into the concept of global health kind of together with or right away. It was always sort of an aside. So, there were early large-scale examples of community health worker programs. And then in 1946, when global health was discussed and debated, you know, community health was considered, but I think you could argue that it wasn't integrated into the whole of the idea of health. And so you had like in the 1960s, in the US, for example, they had sort of this community health center movement. And it was always in conjunction with sort of more biomedical health. And it was always sort of an extension. So there were things like really seminal things like in 1978 where the WHO's push for universal health care, and then later in the 90s, a lot of push as well into very recently the idea that we should have community in health. And I think in 2020 and around the years of the pandemic, I personally noticed that there was a lot more emphasis on community, on mutual aid groups, which of course have been around before that, but they started to, I'd say, proliferate and strengthen, and people started to really emphasize that. And I think in, 2025, there are some powerful forces. And I think there's also in these recent years, this reckoning with the idea of global health and sort of a colonial legacy, and how it maybe hasn't, community has been secondary. And I think even as I think about like jobs I've had, for example, where it was community health. I was responsible for community health in a refugee setting in West Africa, Sierra Leone, Liberian war in like around the 2000s. And it was very much the idea that there was the medical program and then, and we have to reach the community. Like, so I just think it's interesting to understand the history. And again, this isn't a comprehensive, like super detailed research of the history, but I do think it's a pretty fair representation of how the concept of community health versus how it links with or doesn't link with global health and other aspects of health. So a few of and then by the same token, um, surprisingly, it's really hard to find a definition of community health. I went on the WHO website expecting to be able to type in definition of community health, and to my surprise, it wasn't that straightforward. So I found a couple that I think are good definitions. And what you end up having are it's so sort of I think because it's so all encompassing, you end up sort of having themes. And Robert Wood Johnson Foundation actually I think does an even better job, although the aspect of health disparities and equitable access to healthcare you see with the NIH one, but you still see the idea of community access to healthcare. So the focal point is the healthcare as opposed to all the other things in community. Whereas Robert Wood Johnson Foundation, at least, is really focusing on the social determinants of health and the idea of all of those determinants. I'm sorry. All of those determinants being really important for overall well-being, and that it's not just the absence of disease, but the overall well-being of individuals and communities. So that too, I think is very important. So my working definition that I propose is sort of pulling out these key areas. I think the idea of social determinants of health is absolutely essential. The other part is that it's inherently, if you are talking about social determinants of health, you have to talk about multidisciplinary and intersectoral approaches, right? Because social determinants talk about things like economics and education. There's also the part about community participation and the need for, local and global action. So does anybody, what are your thoughts? Does this definition, are there things missing from this one, for example, that you feel like should be in there, or and not to like wordsmith it, but just overall concepts? Does this like resonate with you? Katrina? Yeah. Do you want to go ahead, Katrina?
Hi, can everybody hear?
Katarina, sorry.
And lovely to meet you all. My name is Katerina. I'm based in South Africa. I'm actually an anthropologist that has gone into health, into interdisciplinary research, specifically looking at breathwork in childbirth. I think something that stood out to me also is, so my current mindset is also in South Africa, there's currently a doctor that's actually passed away due to neglect in a intern doctor that actually passed away due to the neglect he was experiencing in the hospital that he was supposed to be studying in. And I think something that then stands out to me about community health is, yes, the need for local as well as global action, but there's also, what's the word I'm looking for? Liminal communities that happen within health, where there's a community that comes together due to a specific initiatives and then actually tries to create a new path forward that is in between what's happened and doesn't want to go forward with what is continuing in that moment. Does that make sense? I feel like I've gone.
That's great.
The reason I'm saying this is also because, for example, I am usually not a part of the medical community, not direct, not completely in it. And I've somehow been a part of a group that's now been organizing a vigil for this doctor that is taking place at UCT tonight. And I think that's why the concept of liminal communities has also appeared for me, because even though I'm not the immediately, oh, you're definitely in this group, in this community. It's so important to me because of my past research, because of my friends who are doctors. And I feel community health really needs to also be pointing out that the doctors and the healthcare takers that are within the system are also individuals that require that community health as well to be able to promote that community health. Yeah, just that's my input. Thank you very
No, that's fantastic. That's a really great point. And also you're just, confirming the value of sort of intersectoral and multisectoral. Anthropology is like a huge important discipline for health and community health in particular. So thank you. That was, yeah, really great insight. Nicole, you had something as well.
Yeah, a thought that I had about community health in Katerina, I think this somewhat relates to what you were saying, is that when we're thinking about communities, right? A lot of it, I feel like without health, like just thinking of communities that we're a part of. And Charlie, you had mentioned that it spans geographies, it's more related to identities. So are you a part of a community? Or can you contribute to a community, or in the context of community health, if you don't identify with the identity that's unifying the community? And I don't know if this maybe it's a fallacy that I have in thinking about community health. It has a geographic boundary in a sense where we're looking at like localized communities and focusing on the local health needs, which can also have parallels to other communities globally, which is the connection there that Molly, I think you had mentioned in the beginning. But it's just, I don't know if it's like something that's missing, or it's just another way that I'm thinking about this, coming from a perspective of how we understand communities, and then how that relates when we're thinking about community health and the identities and the social identities that we have.
Awesome. No, thanks, Nicole. And there is well, I hope that a slide coming up is going to clarify and reinforce that point, because absolutely, I think the shared identities is a thing, and that it's both local and global, but there's also this overlapping. So very good point. And yeah, we'll I think the next slide or two, we're going to actually touch on that. Which maybe I'll go ahead and do now. Thank you so much for those inputs. Yeah, so this is just, I was like putting in all the words for lack of, just to, oh, geez. But this point, I think, touches on what you were saying, Nicole. The fact that, there are the things on the left, which I think I mentioned before, but then there's a reality, whether you're talking about geographies or affinities. For example, the LGBT community is, I would call, a community, right? And there are local contexts. And there is also that there's a global, if you were to make things better for that community, I think you would want to do it locally and globally, because there's connections. And in the not alternative, like global and community health class, we talk a lot about sort of the introduction to it is very like emphasizes a lot about globalization and transitions. And so that's where I think those things come into play, where it's both. And then also it's intersectional. And I think actually the liminal communities point can get at that, because you can be, a lot of the work that I've done with stigma in healthcare settings and among, against people living with HIV or LGBT communities has to do with this idea that healthcare workers can be giving care. They can also be stigmatizing. They can also counter stigma, but they're part of the community. So if they're affected by violence or stigma, they're part of that community, but then you also separate out healthcare workers. So it's not as straightforward as you would think. And then also it's dynamic, it's changing, it's influenced, and it's influencing, which again, maybe is it touches on the point that Katerina mentioned. And it's situated in a context which I think is both local and global, because there's no local community really, I don't think, in the world anymore that is completely isolated, and these days I would say protected from the rest of the world. So that would be my argument. And so then, just jumping into the context, and again, I really struggled with I struggled with this presentation. I really wanted to do this topic because it's something, it's probably, if I had to pick one single thing, it kind of sums up all the things that matter a lot to me. But it's super depressing. So I worked really hard to add this positive slide. It was very negative. I'm like, okay, I'm sure there's a bright lining, because I tend to think like a pessimist and act like an optimist. But the reality is, I do think some of the advances in public health have had some benefits for some communities. Overall, communities around the world are living longer. There are lots of medical advances that are enabling people to live where they would have just, died from those diseases. There's elimination of some diseases. Sadly, measles is on the resurgent, but polio, for the most part, guinea worm, and which is a neglected tropical disease, and smallpox, rinderpest. Also, there's some progress, and I think in terms of there's a typo there, bringing person-centered care to people where they are. So I think that's core to community, because there's definitely, coming back to my point that I was mentioning earlier, where there has been such an emphasis on the medicalization, like the healthcare system, and that's like the holy grail, whereas now at least even that healthcare system is recognizing, oh, we have to bring it to where people are in the community. And community health workers have been really professionalized in a lot of places. There are some digital innovations. I would say there's an increase in community-based programming and partnerships. Universal health coverage is a huge global goal. And there's also a recognition and investment in social determinants of health. So that's the one positive slide. I'm sure there might be other things, but I'm just sort of thinking globally here. So I think the really difficult and grim thing right now is that communities are under threat. And again, I think some of the aspects of communities dealing with locally and globally, inequality within countries and between countries, and the disparities in access, and all the different ways that inequality is showing up. There's been an increase in that. The level of disparities is, the scale is just increasing, and there's also backsliding in progress on a lot of things. A lot of the human rights gains that had been made are coming with such resistance that it's actually backsliding in some countries. And then climate change. Climate change is the source of so many challenges, and as it is leading to increases in the frequency and intensity of weather events, then causes more stress on the ecosystems, and so those inequalities become like more deadly and devastating, and leading to exacerbating, either causing in some cases or just exacerbating existing food insecurity, conflict, mass casualties, and just disparities in health and social determinants of health. And then, of course, the attacks on community themselves. We have the attack on truth itself, the attack on science. We have an increase in authoritarianism. This is like a documented thing of people that follow trends. And there's an ongoing genocides, and I mean, I don't even know what to say about Gaza. Like there are such clear and obvious like attacks on literally the existence of communities that it's hard to even talk about this because it's like, well, what's the, okay, why are we talking about community health? It sounds so, it's feels like the problems and the challenges are so much bigger than community health. But bear with me. I'm going to sort of get to some thoughts about this. So, and then also, alongside, I'd say the failure and disrespect of humanitarian principles and human rights is exacerbating those things. And then we also have, Indigenous people, especially women and girls, are experiencing disproportionate levels of violence, sexual violence and murder, which are, rooted in colonial legacies and systemic issues, discrimination. And again, you see like the effect of climate change also being connected to this, exacerbating these things. So we also, I mentioned earlier about the LGBTQ, plus community, and also just gender-based violence in general. There's a lot of important research coming out documenting these things. And I mean, just because we haven't documented it doesn't mean it's not there. So it's like it's the research and the science is growing. But we know, I think, it's going to be increasingly evident. So the increase in femicide during heat waves is something that has come out recently. And again, just the backlash, particularly I think in the LGBT community, there's been backlash, and then it's further eroded by political repression, cultural and religious conservatism, disinformation, and economic inequality. More challenges, just this massive increase in forced displacement, and also climate change is exacerbating or in some cases causing this. Majority of people are displaced within their own country, and I think it's you all probably don't have this misconception, but I think a lot of people do have the misconception about it's mostly low and middle income countries that are hosting displaced people. So I think that is like a further challenge for those countries. And then this is too sensitive to my touch. And then this more of the sort of traditional challenges, also the rise in infectious diseases and threats of things like COVID, and it's not even if, but there will be more novel viruses due to the increasing proximity of communities living next to wildlife and animals encroaching on their space because of so that's there will be more new infections, novel viruses and threats because of climate change and changing ecosystems in that way. Then there's also the declining vaccination rates, antimicrobial resistance, misinformation, disinformation, mental health challenges of social isolation and disconnectedness. And then also this issue of cyber threats, and which can affect actually the health system and impact healthcare delivery. So this is how I feel about all of this. I don't know about you, but another question, and in fact, I think it was one of you that was raised on another call, was, how, and for me, it's like how in this context of all of these, just tragic tragic circumstances. You could pick any one alone, do genocide or any one single thing is like one of those things on those lists are tragic, right? And so if we're concerned about planetary health and people's health and communities' health, how do we, what do we do about it, and how do we also like sustain our efforts? Like self-care, I feel like doesn't quite sum up what I mean, and is sometimes sort of, I don't know, maybe either trivializes or is trivialized. I'm not sure what the appropriate way to put it is, but like there's just there's a reality of people either who are communities that are under attack, and it's almost the whole world these days, so like how do you sustain, like how do you kind of fight against those these really like difficult trends and make progress and sustain efforts? Like how do you as young professionals in planetary health like face these challenges? And I think I'm going to just stop here just for a second and see if anyone has any concerns or comments before I continue. No. Okay. Okay. Well, I now want to sort of come back to community health after understanding this concept, this context, and then come to community health and see what does community health like actually sort of tell us, and again just sort of looking at these sort of formal global guidance and guidelines. I again find it surprising, and sort of in the context of like thinking about how we can reimagine global health and how we might include community health within that. There's definitely like lots of calls for community participation, for focusing on community outcomes and community outreach and community access and community justice. And one of the main areas, for the World Health Organization, for example, is about, promoting universal health coverage through community engagement. And so there's a lot of different guidance on how to, I think, increasingly sophisticated and effective guidance on how to, work with communities and identify areas to move forward on as priorities, and focusing on sort of these principles. But I also think it's good, and what I want to sort of make a case for here is that we might also, and this is very much a yes, yes, we absolutely need to use science. We need to use like the instruments that are in place and sometimes being further developed, like human rights principles exist. It's very clear what the Universal Declaration of Human Rights is. It's very clear. It's very clear that there are humanitarian principles. It's very clear. You can go on the WHO website and see what those global goals are. And there's lots of other, global kind of guidance for how to assure, like even in crisis settings, there's something called like the Sphere guidelines has like minimum standards for, say, reproductive health in crisis. So in any given community, including local health authorities. But I think like for me, given and so that's my formal, if you want to look at those things in depth, you can take the formal global and community health course, and I support that, and it's important. And I'm again sort of making a plea for a yes and that we consider that these are just really there are vexing problems in the world. They call them, or wicked problems is a term to describe things that seem to not have any resolution, or at least not a clear-cut one, or not one that we've come up with. So looking beyond kind of traditional public and global health to the arts. So not as a instead of, but as a yes, science and global health and the standard guidance. And also I think we're missing a really powerful opportunity by a new opportunities in the arts. So Bell Hooks, as a literary artist, I think has a lot of interesting work on both community and the arts. And so I thought it was interesting to kind of like put side by side her definition of community. It's not health, but I think a healthy community is kind of what she's getting at. And you can see it has a lot to do with power, like really looking at like the ways that power is, asymmetric power is perpetuated, and how that affects community. So she's urging that it's kind of an ongoing thing. It's an ongoing effort, and because it's the push is against against equal power. The push is like to the push is towards domination. So we have to constantly like be vigilant and work against it. So I think that would make a huge that would be huge in terms of community health. The other important thing that sort of that comes loosely from her, or probably more explicitly from her writing also, and others, is the idea that communities, just as they can be under attack, they also, in public health, we a lot of times there's a lot of empowerment or participation or engagement, but like it's not very empowering if you're being empowered. So I think when you look at the arts, music, literary arts, artists, street art, this is from a mural. I think that the idea of like communities already having the power, like that they do have the power. They have the power to reframe, to reclaim, and to reimagine that shared narrative. So we talked about community as narrative, as shared narrative. So, and I think actually art is a way that it transcends borders and language, and actually helps to actually make that possible. So again, this is she's also calling for the importance of inclusive communities where all voices are heard and respected, and a sense of belonging, shared identity. So diversity, equity, inclusion, and belonging are essential. It doesn't matter if some government decides that those are banned words or banned research. The reality is that we, as people who are concerned about planetary health, have to embrace that. Like we can embrace it just among ourselves, among our friends, among the people that we work with. Like really like making that a reality. I think is something that we can actually do. And really make a difference in through the people that we work with, and then in the work that we're doing in communities. And again, I think the arts actually offer a way to, sorry, it's taking control for me. offer a way to really make that possible. So concretely then, like, we need to survive and sustain our own efforts, and to counter all of these things, these isolation, disconnectedness, acknowledge and leverage intersecting communities, and then acknowledge, value, and promote inclusion and belonging and equity and access. And I think harnessing, creativity, yours and the communities, is like a opportunity that we just haven't taken advantage of. So there's actually a lot of science on this, believe it or not, that, this again is is coming from bell hooks, but the idea of art helping you to, because it's nonlinear, it actually does, there's actually a study on this, where they looked at people that, had viewed art, and after they viewed art, they were better able to see like the big picture. Like it literally changes your brain. And this book, Your Brain on Art, is this incredible book. I highly recommend it to anyone that has any interest on this topic. And it's sort of, I think, been like a pivotal kind of book on this relatively new field of neuroaesthetics. It's basically like the science of art, and the book does a really incredible job of documenting scientifically, using scientific methods, like what changes occur in your brain when you're involved in art. And again, it's like music, visual arts, any kind of art. So, reducing stress, anxiety, helps you to have big picture. And so it's even, there are things that have been funded. I hope they will continue to be funded, but where, they're prescribing art as medicine. Like it literally is helping people to connect. It's actually, in a very real way, countering some of these threats on community. And then similarly, there are ways of using art as research. This is another great book that I recommend, where it's a way to make things more accessible. It's a way to sort of rethink how we're collecting information, how we're using research, but in a more accessible way that is, knowledge systems that aren't sort of hierarchical. And documenting as information. This is a artwork inspired by Native American calendar, which is something that's really used in low literacy populations, and then art as resistance, of course. And just this idea of, then this is sort of like the idea of using, this is interactive art, but the idea of how do we use art as something to work with communities to like reimagine the community? How do we transcend sort of like the idea of this specialist knowledge? But it can be in complementary, it can be in collaboration. It doesn't, again, it's not one or the other, but how do we overcome some of these vexing challenges by like working together? This was a really powerful work. Art is survival. Like art, even in all contexts, I think it's something that people have since the beginning of time. It's literally something as old as community. It's it taps into like a humanity. It's something people use to survive through grief and trauma, and it inspires new ways of thinking. So it's nonlinear. It's something that I think we could use more, and also document the effectiveness of more, but also even use it maybe within global community health or global health to think about how we might, reimagine even global health itself. this is you know, Sweet Honey on the Rock. They you know, started during, you know, the height of the AIDS epidemic, and it still continue. But it's also sort of this idea of not just surviving, but like communities, like through these like dark times that you know, community, it brings sort of humanity through difficult times. And you know, the idea of joy as resistance, I think is pretty important and relevant for us as people who care about these issues, and work in planetary health. But also, you know, it brings people together. It gets people through times which are just core, in my view, to health, to mental health, and all aspects of resilient communities. I think I'm gonna stop there and open it up to questions, comments, your thoughts on these questions. I think you're on mute.
Just to whet the appetite of people and start asking questions. I can say, whoa, I wish, Mori, that you had been my teacher 20, 30, 40, 50 years ago. What you have given now gives really, really, really a very specific and the same very comprehensive view of what community is and what community health is and should be. The other point is that you are merging something that I hadn't thought about, this concept of art, of something else, of bringing something new, different to a community or to people. I trained in family medicine, and I was a professor of what they call, at that time, community medicine in the 70s. And I also worked at the primary care unit when I was at the Miami University. And again, I wish you had been transferred in time, transported in time, because we learn little by little all the things that you are mentioning now. And one of the concepts that is very important is that we all belong to many communities, not only to one. Background, demographics, country, language, art, etc., etc. And I wish people, young people, everybody would listen to this community. At Multipod Mentoring, you are a member of Multipod Mentoring. I think people will benefit enormously of this kind of I wouldn't say conference, but interaction with young people. And my other point is that this should be a series, not only a master class, but a series, because this is so important, so important. I wrote a chapter in a book on community health promotion. And when I listen to this, I say, I should have copied this presentation.
I probably referenced your work here. We're building on your work.
Please, I encourage your people to ask questions or to add to this master presentation. And again, I have worked with diverse communities. For example, I was a physician in the jail in Dade County in Miami when I was doing my residency. And I worked in all the Mexico City prisons, all the inmates. And I myself, I'm a member of a very privileged Lebanese immigrant community to Mexico. So one thing I would like to add it's at some time about 10 years ago, I tried to start a community project in 5 countries, and it didn't progress. It didn't. But the idea was to introduce something that we call at that time the community health navigator, which was some kind of somebody with knowledge and know-how, and also an excellent communicator and salesperson, but somebody who could establish links to people in the community and work, as you mentioned, intersectorally in the community with everybody to make sure that all the concerns of the community are addressed and that can overcome some of the obstacles. Many people say we don't have the resources. Yes, they may have the resources, but they don't know that they have the resources. I'm sorry, I have talked too much, and I will encourage people to ask questions and to add to this. Especially Charlie, you can make wonderful comments about colonialism, and everything that you have been working on. And I take this opportunity to invite you to another workshop or forum, if Molly lets me, on Friday, this Friday, the 23rd. Molly is going to open a discussion group on gender and power, which is another community. I belong to a male, totally masculine community all my life. And that's why I never learned what I should have learned and what young men are learning now from young women and from society. Again, I wish I had been born at the time you were born, because everything is changing. So I encourage you, it's at the same time that this master class, or on Friday. Molly, I'm sorry, but I'm inviting everybody.
Yeah, definitely.
To start that group. We tried to start it 3-4 years ago, but now is the time to really, really take this seriously and start working. Because as I have mentioned many times, 70% of our mentees are women, young women. And you are in charge of this century. And it may take 200, 300 more years, but you are going to be the ones directing humankind in what we should do next. And it's going to be very different of what men have done. Okay, so this is my intervention. So please.
We need your intervention. Thank you.
Thank you, Dizzy. Thank you, Dizzy, for sharing this this webinar that's coming up by Molly. And I will share with our CGHI community. I already have the meeting link. Yeah, so I just to also fill in the gaps, and also I would love to share my thoughts, my reflections from Molly's masterclass so far. So I love that Molly's masterclass focus on a community-centered approach to global health and focusing on the agency. And I love when you said that, it's not just about empowering, because empowering is also from a point of view that there's we're not equals. And I love that, using art, music, dance, and sports in community health and healing to create a sense of belonging and agency, because you are the one who's in charge of your body when you dance, when you do sports, when you write, when you sing, when you paint, and you get this sense of agency and creativity that you can really express yourself. Because sometimes we don't know how to process what we're thinking, what we're feeling, our trauma. So when we put our feelings into songs, into art, into doing sports, I think that's really healing. And that's also why, like, I am now in South Africa, in Cape Town, and I am very exposed to the different NGOs here as well and the work they do. So they also incorporate art and sports in their work. And I also loved that Molly pointed out that, back in the days, a lot of times that there's a medical program and then there's the community program. They are separated. I think nowadays we can see that they are being hopefully more integrated. And yeah, I think it's a different time now, and that's why we're here today, and we're learning from senior professionals like Molly and DZ. They are engaging with us as young people as we reflect, and we give them our point of view as well, and they can share with us how it was like before. And I love that, Molly and DZ, they are so happy to engage with young professionals like ourselves, so we can have this intergenerational, cross-generational discussion that's very productive. So yeah, and now I want to encourage everyone to share some feedback, and then because Molly also prepared a very beautiful, master class, and we still have more to go. So I would want to invite everyone to quickly share a few words, and then we will return back to Molly. Molly, do you want to say
Sorry,
something? Yes.
this is actually this is actually the end of it. Yeah, so whatever, please talk away. Yeah. Your feedback, and thank you. You really articulated those points so well, Charlie, as well about the ways that these approaches can really enhance agency and things like that.
Thank you, Molly. Maybe some prompt to our CGHI members. I would say maybe, yeah, you can share with us what you learned from today's masterclass, what stood out for you, and what is the career path that you are currently pursuing or you want to pursue. Yeah, and any prompts that Molly might think of.
Yeah, no, thank you. I think those are great, and also just are there things that resonate in terms of things that you could implement in your own community, not necessarily, it could be through your work, but it could be yeah. So go ahead, Nicole, sorry.
Yeah, I just wanted to say that I really think you have given us a thought-provoking and as Dr. Zacharias said, a comprehensive understanding of community health, but also challenge the way that we think about it or the way that I think about it, and also connected two things that I am very passionate about, which are health and art. And I love that you have included art as, to me, it's hopeful. And it was so thought-provoking, the question you asked in the middle of okay, what do we do right now to push back against all these trends, all of these things happening in the world that are upsetting. It's more than just self-care. And I was thinking, well, you have to push back against those things becoming normalized. And I think that that happens at a local level, which is within the community. And also understanding, you had mentioned the power dynamics, and I really agree that art is a way to reclaim the power. I've done some research from a sociology perspective on the power of street arts within social movements, and I think that can very much be applied to health. And it has given me so much to think about and to research further. That I just appreciate that you have helped us, like given us a way to answer that question, because sometimes when we're thinking about the state of global health, for example, it can be somewhat hopeless, but art is a way to think creatively and to dream and to envision. And I think you had a quote from Bell Hooks that was talking about it's not just sometimes the purpose is showing the state of the way that things are, but it's also envisioning possibilities, and that opens up to me like a realm of possibilities when we think about art, like visually or like physically with dance and music and just all the different ways that they can help improve our health or help us respond to, you know, defining community health and creating change there. So thank you.
Yeah, thank you, Nicole. And also thank you because I think I focused more on the negatives than you. So thank you for adding a positive, hopeful note, emphasizing those points. That's important for sure.
Thank you. So I want to encourage our members to share something. I will read out all your names, and then you can feel free to unmute yourself when you're ready. So yeah, Tarek joining from Sudan, and then Carmen joining from Germany, Adrian joining from the US, Zara joining from the US, Eniola joining from Nigeria, Ansovo joining from South Africa, Omnia joining from Egypt, and Marian. I don't know where you're joining from. I think it's Egypt. Yeah, feel free to unmute yourself and share a few reflections. Thank you.
Yeah, I guess I can go really quickly. Thank you for your presentation. It was really, really interesting, and I kind of learned a lot from it, and I got a lot of reflections from it that will definitely kind of influence how I think about community health now. I feel like what I really gained from your presentation is more of just a reflection of like understanding ways we can kind of navigate the community health landscape, at least for me being in the United States, and how the state of public health and global health here is right now is really confusing, like Nicole was talking about. So I think what you talked about was a really positive and like new way of approaching it. So I appreciated that. And it makes me feel more hopeful about how we can improve things. So thank you.
Awesome. Thank you. I did want us to be more hopeful because it was selfish. I was trying to find a way for myself to be more hopeful.
Anyone else?
Can I make one comment? Moni has given us a few challenges. I think one of the most important ones is the definition of community. And the community can be as big, as large as 8 billion people if we are talking about all humankind. What is necessary is well, not necessary, but as a definition, communities are people. So what is the lowest number of people that you can call a community? What is the threshold? And for example, some people say that each individual can only have, I think, less than 100. I think it's 117 contacts. People that you remember, people that you know. So one of the things that I would encourage people, because we have been struggling with this for such a long time, is how do you define a community? The second point is that we are all members for a very, very special community, the community of intellectual workers and the community of artistic, because everybody should be as well-rounded as Molly and as Charlie. I don't know if you have seen the blog of Charlie and the art that she recommends. I mean, it's amazing. She taught me about Chinese music and the butterflies. I still remember that and listen to that every time, the combination of Eastern and Western music. And okay, so that's one of the challenges that Molly has given us. And I would like everybody to think about that. And the second point is how to do something with the community. And there are so many challenges there because it depends on what the community needs to have. And the third one is that remember that each and every community has resources. So our obligation as consultants, as workers, as whatever, is help them find the resources in their own community. And of course, find out what they need from the outside world. Because otherwise, we're going to continue the same cycle. You start a project in a community And I was very frustrated because my students will come and say, okay, I found out that these children have a problem with their vision, but to send them to a place where they can test their vision and do something with lenses, and they say it takes 6 months or something like that, and it costs this much. So they cannot afford to do it. So there are problems that you cannot solve, and we need to think about those, and which ones are not medical or health related, but are engineering problems. How do you get into that? Providing water, some construction, etc. So, Molly, you have given us some assignments, and I don't know if you can summarize what are those assignments that you can give to homework that you want to give to all of us, because that will be really helpful. What are your assignments to us as a master in this area?
I mean, I really am very sincere when I say that I have like hundreds of slides for this presentation. I sort of like went down all these different paths. But aside from, a couple of questions that I've had in some discussions with some mentees, thank you for those questions because they obviously inspired some of this, but also I literally have been struggling, like trying to figure out what to do. I do my own art and I use some of it in there. And the tagline of my business is reimagine, create a better vision. And it emphasizes like the joy, the bright colors and the joy and the interactiveness, because that's for me is the joy. But I've been using it to get through the grief of the caregiving situation I'm dealing with. I've been using it to try to, create DEI earrings as my little like act of personal resistance when maybe I am busy caregiving, so I can't go to the protest, but I can wear my earrings. Or but also really realizing that question you raised about the communities, I think is totally core, because again, I think from what I've noticed from this caregiving situation, and this is when a few years ago, when I really started to look into art and how to connect isolated caregivers, and things like that to kind of overcome some of these problems. I think you can't just be one. Community is not one, and it can't just be virtual. It has to be, and again, I'm seeing this more now that I live in an authoritarian regime, like it has to be, you have to be in physical community. And so I think the global local is a thing, but what I would really challenge people to do is figure out, are you in community? Are you working in community? Not virtually only, it can be also virtually, but where you are you yourself working in community for whether it's for your own well-being, hopefully also for the community well-being. Like, I think that's the part that if we, a lot of these things, like all of them, climate, violence, genocide, all of it is connected. Those things are not happening on their own. There's global things. And if all of our communities are stronger and more engaged locally, we're gonna be better off, because if they're not, then no one's voting, no one's represented, nobody's protecting one another, nobody knows one another. Like, so my challenge to everyone, myself included, is no matter how busy we are, the community where we physically are, and it can still be thematic, like, women or LGBTQ or migrants, or it can still be that, but you have to include at least one community where you are, or else we're just all doomed. This is something I've been thinking a lot about and been trying to, yeah, that would be my challenge. And we could do our community art project if we have time right now. No, but we're at the end, I guess. That could be the
Yeah,
second one.
Molly, I think we could, if it's like we can do it within 5 minutes, I guess we could. I think it would be very interesting for people to try to do it, and I would love to collect any burning questions from our audience, and feel free to ask in the chat or unmute yourself. And Mariam is from Nigeria, and she asked in the chat to Molly, based on your insights on community health, what do you believe is the most effective path towards achieving universal health coverage? And I guess since she is from Nigeria, maybe we're talking about in the context of Nigeria or similar countries. Molly, thank you.
Thank you. Yeah, I mean, again, the local community, where I've seen in other West African, I haven't worked in that in Nigeria, but in neighboring countries, very, very localized organizing so that people, again, it might be using art so that it's accessible, the information is accessible. What are the benefits? What are the benefits to participating? I think that's going to be my repeated take-home message is for a lot of these things is it's our only hope, including for universal. And it's a yes and. That's my other thing is no, most of these problems will not be solved only by local communities. There's obviously large, macro, powerful trends and actors. So it's yes and, but we've been ignoring the community part is just, yeah. That would be my thought on that and not having any answers. That's just my idea.
Can I add one thing, following what you said, Molly? I think I remember a long time ago, there was such like activist burnout with Black Lives Matter and with also anti-Asian crime during COVID, in the beginning of COVID. And I learned this quote, I don't know from who. It says, look at the helpers. So I think in this day and age, it's very easy to lose hope and feel frustrated because of what's going on in the world and to feel powerless. So I think it's important that we start talking to our colleagues, our peers, our classmates, our mentors, and our family, our friends, so that we don't feel alone and we can, talk about strategies together and enjoy, also like find joy as well. And to also, for example, with CGHI, with Multipod, you can meet people virtually from all over the world. So you already found your community. That's one community that you can, you share similar values and mission and vision, and then you can expand that. And I just hope that, people can start to recognize their agency and power and then start building their little units. And then I think that because people might think, oh, how do I find my community then? Or how do I join a community? You can start one yourself, and maybe you're already in some small units already. So that's what I wanted to share. Yeah, and back to you, Molly, in case you want to teach us about the activity. Yes, Dizzy, go ahead.
Let me intervene for the last time. I have good news for you. Okay, and Charlie knows this, and Anaili Vaquero from Colombia knows this. I am delighted that Molly Fitzgerald is going to be my successor at Multipod Mentoring. And I have been trying to find somebody since 2021. And finally, Molly has agreed to be the force for renovation, for innovation, and for changes and progress in what we do at Multipod Mentoring. So I'm sorry that I announced this without your consent, your agreement, but I wanted to make sure that you don't say no at the last minute. At the last minute. So please hold her to her promise that she's going to be the next voice and force and power of Multipod Mentoring, and that you all be part of that community. Please. Now, Ollie.
I want to reassure people that you're still here and you're my mentor. So you're not, I'm gonna roll up my sleeves, but yeah, you promised you're still here. So yes. And yes, I know I'm speechless. I wanted to just add one little thing, maybe, and I shouldn't add because you all have already articulated everything so well. But the AIDS activists, this famous quote about we fought in the day, and so that we could, we buried bodies in the day so we danced at night. So I think also we all need to, community is not only struggle, it's like also celebration, and that we have to, doing that is, it's not extra, it's something that even communities literally under attack do it, because the human spirit just cannot survive without a little bit of that.
Molly, do you want to share with us your activity or exercise? We can do it
yes.
now, or we can do it in our own time. Yeah, thank you.
Should we just do it real quick? If everyone has a piece of paper, I was just trying to think how you could take this into your own world. And so either, just on the piece of paper, draw a picture or a word summarizing, what your action is going to be. And then we're going to share it, and it's going to be a community art project because we're all going to see it on the screen collectively.
I want to encourage everyone to turn on their camera if they feel comfortable, and please take screenshots from your side as well. Thank you.
Here we go. Is everybody ready?
Are we ready?
So we're just going to go like 1, 2, 3, and then hold it up, and then we'll all have our community art installation on the screen.
Molly, you can.
Okay,
time.
ready? 1, 2, 3. Oh, can we see?
Can someone take screenshots? Adrian, can you take screenshots? No? Carmel, who can take
Let me see.
screenshots?
I'll take it. I'll see if I can do one.
I can take it. I took one already.
Thank you.
Oh, good. Okay.
Maybe someone can share what they wrote quickly. I will share first. I
Okay,
said,
go for it.
I wrote, share my joy, uplift, inspire, hold space for others, listen, learn, and celebrate. Nicole, what did you write? You're on mute.
Sorry, I just drew a quick picture. I think it's not really showing up, but it just shows it's like doing it's supposed to be like me doing a painting and then looking out on the world and these negative things, but using art as a way to inspire like myself and my community.
Awesome.
Thank you, Nicole. Who else? Carmen, what did you write? If you want to share.
Yeah, I wrote resilience because I think it's more or less what we need at this moment with complication and with difficulties general and worldwide. But I think we are more resilient than we imagine. And yeah, that's why that was my word.
Thank you, Carmen. Dizzy, do you want to share what you wrote? And then also Molly. Thank you. You are on mute, Dizzy.
Right. I think that Molly told us also if we wanted to draw something. And I drew one. Well, I don't know if you can see that.
Many faces and a heart.
Oh,
Yeah,
awesome.
that's the concept of community. At the center, you have the core, which means heart, and then you have people around it, the community. And I think that's an important message.
Thank you, Dizzy. And Molly, what do you want to share?
That's beautiful. I use words, I resist and spread joy and hope through art.
Thank you, Molly. And Tarek wrote in the chat a candle because he is from Sudan and he's currently back in Sudan from Egypt. So I hope that we also educate ourselves on what's happening in Sudan and share what we know with people around us who don't know what's happening in Sudan. Thank you, Tarek. Yeah. And Molly, do you have any concluding remarks?
I just want to thank all of you. I love to do things like this because I learned so much from you, and I want to thank you, Charlie, for your leadership, and Dr. Zacharias for your leadership and mentorship and all that you've done to for all of us, for these two communities, really. But CGHI and Multipod would not be communities if it weren't for you. You've brought together community, which is an amazing thing to grow and to start and build and grow and have thriving communities. As we're very grateful. So thank you.
Thank you, Molly, and thank you, Dr. Zacharias, for joining us today. And thank you, everyone, for taking the time and join us online today. And please remember that on Friday, Molly is also giving another session on global health and gender, and I'll share the link with you, Gender Transformative Approach. Yeah, so thank you so much for joining today, and we'll be in touch. Have a nice rest of your day. Bye,
Thank you.
everyone.
Thank you so much, everyone.
Thank you very
Bye.
much, Molly.
Thank you so much. Thank you.